I want to talk to you about my title is Optimizing the Use and Value of Digital Health so that we can advance care. Now, I think almost everybody here is in the healthcare industry in some shape or form. Many clinicians with us, many administrators, etc. And you've got to admit that in recent times, the whole issue about person-centered care has entered our lexicon. It's entered our vocabulary. There are papers written about it. There's strategies on it. It's on everybody's websites, etc. And the funny thing about it, of course, is that if you're a patient, you wonder about this patient-centered care and say, well, what's actually been happening all of these years? Isn't it really about me, the patient? Because from Canadians' perspective, there's just a few things they care about. They do care about their access. They do care about the fact that at times they've got to repeat their histories and their ailments over and over again. They do care about the fact that, they have been on a medication for the last 10 years and now it's time to have it renewed, and they have to show up at their physicians' offices again. They can't do that online. They do care about the fact that they can communicate with the rest of the world and seek advice on the internet, but they can't have a virtual consultation with their clinicians. They have to take anywhere between 2 and 3 hours off work or school to go see somebody for a 5 or 10-minute appointment. There's been enough horror stories around aspects of safety, and so Canadians are concerned about that. But the good news is I believe that certainly the new generation of Canadians are getting a lot more demanding, should we say. They really do want to participate in their care. They want to be part of the team. They want to be part of the team with their clinicians, jointly choosing wisely, taking decisions that are evidence-based. Of course, none of this can happen if patient-centered care is only words and patients are still left in the dark. You know, from a digital health perspective, and many of you are practitioners in the audience, we've been at this game now for the past, the last decade. And even at the start, we had this construct which really did put the patient in the middle and understood that the patient goes to various different points and at various different points leaves a bit of their DNA, their footprint, and a lot of times that footprint and those trails are sort of locked up in those silos. And so, how do you bring this information together so it's on a longitudinal basis? It's there for the clinicians when they need it to be able to take or to be able to make faster and more accurate diagnoses. But I got to say it's pretty easy to write strategy papers that talk about patient-centered care. It's pretty easy to draw diagrams of putting patients in the middle. But none of this is truly enough if we're really talking about transforming care and using, in many cases, IT to bring quality. So what does it take? Well, it clearly takes leadership. It really takes thoughtful innovation, a deep focus on individual Canadians' needs. We believe, obviously at Infoway, that an important part of that solution is advances in digital health, and I suspect most of you believe that, otherwise you wouldn't be here. But just getting the right computer at the right place, which we thought would have been great, is not enough in itself. Clearly, integrating new capabilities into clinical workflow, improving access and safety, engaging patients and their families in new ways to enable new models of care, and really support the many transformational efforts that are going on across Canada is absolutely essential. So, are we there yet? And this is a this is a good news and a bad news story. Yeah, we're there in some aspects, but in other aspects, not so good. When you take the fact that 10 years ago we started emptying the filing cabinets and starting to digitize the key components of an electronic health record, whether it be drugs, lab tests, identifying Canadians uniquely or providers uniquely, diagnostic imaging, and variety of clinical reports. As you can see from the right-hand part of your screen or left-hand side of your screen, a lot of that is in place. Drugs is still lagging, but it got started late, and we are playing catch-up. Our two large provinces have got to contribute to that, and those numbers will get to 100%, I believe, in the next 18 months. So we're making this information available, but it's not just good enough making it available. What about usage? Well, one of the examples I've taken is usage in mainly primary care with EMRs. Another good news and bad news story. Good news is in 2007, we were at 24%. Today, we're approaching 70%. That's the good news. The bad news is we're still far behind the international norms, which are in the 90%. So there's work to be done. That said, there are benefits that are being accumulated. In every project that we fund, whether it be telehealth or drug information systems or diagnostic imaging or EMRs, we have a third-party independent body do an evaluation study. And since 2007, there's been over $8.6 billion in terms of benefits. Now, what are these benefits? And I'm very careful to say benefits are not just pure cost saving. Sure, if you get rid of filing cabinets in downtown Toronto or downtown Vancouver or wherever else, you're making real savings in terms of floor space. But are you making real savings when you reduce inappropriate opioids? If you start to back up and say, so that reduces readmissions, that reduces people who've been in expensive acute care beds, then you probably are making savings. But that capacity is quickly filled. So clearly in the reduction of inappropriate opioids, the fact that certainly in Alberta, who's probably in the 70s now in terms of the number of GPs with EMRs, and Ontario's not far behind, 94% of physicians say that their patients are receiving their lab results a lot faster, and a very high percentage also say that they're not having to do or needlessly repeat tests because they can now actually find them. One of the biggest advantages is that telehealth has now gone mainstream, and every year, over 300,000 less kilometers are being traveled by patients because of the remote aspects of consultation. So clearly, there are benefits, but quite frankly, it's not good enough. This is a study that we had St. Mary's University do for us. We could probably have predicted the results, where they took EMR practices that were on paper and EMR practices that had EMRs. And they set them a test which said, can you find us patients with 6 types of preventive or follow-up care? Look for things like overdue immunization, look for things like follow-up for diabetic patients who needed foot exams, and what about a mock medication that we need to recall? Well, the ones with EMRs took just under an hour and a half, and they had a high confidence rate that they had found their patients with all of these things. After 40 hours, the paper-based practices actually gave up. So clearly, proactive outreach of this type is really not reliable in a paper world. But interestingly, even in the computerized world, a lot of the clinicians say, hey, to the researchers, that's not the way we work. We are used to actually working with the patient in front of us and looking after their needs. So proactive outreach of patients who needed preventive care or follow-up is not part of our regular practice. So I suppose the study shows that having the capability of an EMR is important, but so too is the culture regarding population management expectations and having the skills and the capacity to use an EMR in a sufficient and a proper manner. There's another study that some of you may have seen in the National Physician Survey, which really shows that, that 3/4 of family physicians claim that they are getting value and they are getting their practices, the quality of their practices improved with the EMR, and 1/4 said there's been no change. And if we look at some further analysis from the same survey, you see that the much better and better improve over time. And this is not only from family physicians, it's borne out as well by pharmacists who for years have been using drug information systems. And they feel that over time, with maturity of use, their quality improves, their productivity improves, etc. So I suppose the question for all of us is, how do you shrink that timeline? How do you accelerate that process? How do we get clinicians to achieve quality gains a lot quicker? And I want you to think about that question, because it is, in a way, the nub of the next 24 hours. But as you're thinking about that, think about the fact that we're working with shifting sands. 10 years ago when we got started, there's been huge changes in technology, whether it's the speed and the speed of the networks, mobile devices, wearable devices, wearable computing, changes in expectation, e-consumerism, changes in role, scopes of practice, types of new healthcare teams, and changes in our understanding of the risk of handoffs, the value of checklists. So it's because of some of these shifting sands and new trends that we decided to go back and resurvey the landscape. And we did that by talking to a lot of stakeholders and asking them on a going forward basis, what are some of your priorities? And very quickly it became clear that they had 6 priorities: healthy living, access to services, this person-centered care, continuity of care, quality improvements, and efficiency improvements. Now, there's a lot of people here from quality councils, and I'm sure you can relate to every single one of those, and those from ministries and regions can relate to every single one of those as well. It'll be somewhere in your mission mandate, it'll be somewhere on your website, in your goals, etc. But for us, what does that mean? How do we interpret that into opportunities in the digital world? And we came up with 5 opportunities for action. The first one was bringing care closer to home. I keep saying that very shortly, the large box stores and the pharmacies will have aisles and aisles of monitoring devices, which you either wear or you can implant or whatever. And clearly, the studies have shown that being able to treat people in their own homes, whether you're a diabetic, whether you're suffering from congestive heart failure, or whether in fact you're suffering from COPD, it helps to reduce first hospitalization by about 50%. It does the same thing for readmissions, and it does the same thing for the hospitalization of people. And what's more, patients love it. They've got to travel a lot less. Providing easier access, Canadians want 4 things. The surveys that we've done. They want to be able to renew their prescriptions online. They want to be able to schedule their appointments online. They want to be able to do virtual consultation. And they want access to some of their information. Maybe not all of it, but certainly their lab results. At the same time, maybe as clinicians get them. Their records for their kids, their immunization records, they want those online. And in some cases, their medication histories. Supporting new models of care. Clearly, there are new models being developed, whether it's family health teams, or whether it's the new health links that we're talking about in this province. If you're going to get that, you're going to be singing from the same hymn sheet, which means the continuation of the electronic health record and the EMR. Improving patient safety. I'm sure in this conference you're going to hear some great strides on things like CPOE and order sets. But how far are we getting in terms of medical reconciliation, especially across the various sectors? And the last one is high-performing health systems. Every single other industry has now been able to take advantage of big data. We're really slow. We're really slow, and I gave you that example of the EMR. So from a clinical perspective and from an administrative perspective, mining these databases so that they can shine light on new discoveries is extraordinarily important. Now, none of the things I've talked about on this slide, somewhere in Canada, these innovations are occurring. And wherever they're occurring, the recipients of those innovations are reaping the benefits. So as somebody says, the future is here, but it's not evenly distributed. And if that's not eloquent enough, this guy, Don Berwick, who many of you know, says it even better. He says it's better for everyone when healthcare IT is used meaningfully. The question is, if it's so good, why aren't we there yet? For everyone, for all the patients, not just the lucky ones in modernized systems. The reason is it's hard moving from paper. Legacy systems to modern IT is a big change. New hardware, new skills, new attitudes, new assumptions. It's really a new culture, and you don't get there in one step. So the question I pose to you as we get started is, how many steps do we get there? And what are those steps, and how long is it going to take? Which is really the essence and the goal of this symposium, to get a better understanding of the possibility of enabling better quality, better access, and improving the patient experience through the use of advanced digital health. To get a clearer understanding of what needs to be done to achieve this promise, and to leave you with a renewed sense of purpose of making the benefits a true reality for Canadians. Thanks very much.